The next talk, we are going to have surgical care innovators in the spotlight. Please come with Ms. Cheri Reynolds. Cheri is the Director of Program Development at Assist International and an attorney. As part of her role as Assist International, she leads Innovations for Safe Surgery 2020 as a multi-partner initiative seed-funded by the GE Foundation, whose gigantic goal is to move the needle on surgical care for 50 million people by 2020. We also have here with us Mr. Hannington Segirinya. He's the country representative for Assist International in Tanzania. He implements the Safe Surgery 2020 innovation program that is tailored at improving surgeries in Tanzania. Welcome.
Thank you, Gustav. Thank you. We're very excited to be here.
Yeah, I'm excited too to be here. I'm Hannington Segirinya, as he has mentioned.
And we are part of the GE Foundation-sponsored Safe Surgery 2020 program that works to bring safe surgery to 50 million people by the year 2020.
Like many of you in this room, we also do believe that everyone, everywhere, should have access to safe surgical care. But right now, that's not the case.
Tonight, we want to tell you the story, two stories, that show the difference between access to safe surgery for a woman in the United States where I live, as opposed to what a woman would face in Tanzania where Hannington lives. And while we know that there's a lot to celebrate in both countries, within surgery and outside surgery, there's still a lot of work that needs to be done. When I had my first child, I was fortunate enough to learn ahead of time that he was breech and that we would need a C-section. And the reason that I learned this was because I had 4 ultrasounds during my pregnancy.
In rural Tanzania, it's very hard for a woman to know way in advance that she will need a C-section, just because many healthy centers deep in the villages do not have ultrasounds.
Because my C-section was scheduled, I never went into labor.
In rural Tanzania, since a woman usually doesn't know that her baby is breech, she goes into prolonged labor before she makes it to the nearest healthy center.
I remember the morning well. It was a leisurely morning. My husband and I were very excited. We got in our car. We drove to the hospital. We had family members waiting for us there.
In rural Tanzania, a woman would get public transportation, maybe a bus or a taxi or even a makeshift stretcher to get to a hospital. This can take even up to 2 days. And this is very, very dangerous, because in most cases, a family would have to sell a goat or chickens in order to fund this.
My insurance covered everything except a $25 copay.
Once at a healthy center, a woman may be able to see an emergency surgical officer, but in most cases, there is no anesthetist or there is no oxygen for a C-section, and this puts her life in danger and the baby's life too.
When I arrived in the hospital, it did not even cross my mind that everything I needed for that C-section would be ready. The surgeon was there, the anesthesiologist was there, oxygen, all the medicine. Everything I needed was there.
If a woman is fortunate enough to have an anesthetist on duty, this will be typically a person probably who has taken 12 months training and earns about $2,000 a year.
An anesthesiologist in the United States has 12 years of training and a starting salary of over $200,000 every year.
In Tanzania, approximately 546 women will die, out of 100,000, will die giving birth.
In the United States, while the number is rising, still only 26 out of every 100,000 mothers will die during childbirth. And this is a huge problem that kills 17 million people every year. That's 1.4 million people every month that die, or 46,575 people each and every day that die because they don't have access to safe surgical care. And these are not just statistics, but these are real people. They're mothers, their fathers, their sons, and their daughters. And they matter, And we know that we have to all come together if we want to close the gaps in surgical care. We know that we can't do it alone, and there's huge gaps that are there that need to be addressed. We can't replicate what works in the United States, but really we need to leapfrog over current methods and devise new ways to close the gaps in surgical care. We have to come together as a global community to solve this huge problem.
In Tanzania, we also do believe that we cannot work alone without engaging our local partners. At Safe Surgery 2020, we work with the local partners and we innovate around 4 key areas. Around people, our Safe Surgery 2020 partner, Japaigo, they're doing leadership trainings to surgical teams in rural areas to communicate better, to be good at what they do, and find local solutions to their local problems.
And around processes, our partners, Lifebox, SPECT, WFSA, they're working on teaching hospital staff on safe surgical and sterilization procedures and how to handle the obstetric emergency. And we're exploring ways to solidify those trainings through remote mentorship.
Around technology, we are exploring ways of bringing safer surgical training to rural healthy centers through the use of mobile phones and applications, tablet applications.
And around business models, we're exploring how to move away from grant funding towards self-sustaining models.
One way we have been able to look at a serious problem is through our oxygen social business enterprise model. Access to oxygen is a serious problem in so many places, and many of you know about this. And it impacts the hospital's ability to perform surgery. In so many rural areas, hospital staff must travel over 8 hours to take oxygen cylinders and have them refilled. This is costly, this is time consuming. It takes them away from their primary goal of saving lives and being at the healthy center facilities. We worked with the local partners to create a solution to overcome this devastating problem that not only delivers the oxygen to the door of a healthy clinic or a hospital, but also creates a business model that keeps the oxygen program operating long after we step away. And importantly, right now it's being funded by an impact investment. We place an oxygen plant at a regional referral hospital far away, somewhere in the middle of almost nowhere, that normally has problems to access oxygen. And then we then set up an oxygen business to run the oxygen plant, ensuring that the hospital staff do not waste a lot of time taking the oxygen cylinders to get oxygen, but rather they should spend this time providing healthcare and saving lives and doing away with the unnecessary deaths that happen at the healthy center facilities. So we do deliver the oxygen to the surrounding hospitals and the health clinics at an affordable rate. So the money or the profits from the sales, they do come back into the business to pay for the maintenance, the supplies, all the costs that are involved around that. And then we have seen a tremendous increase in the amount of oxygen consumption by our partner hospitals where we are operating. And in certain areas, access to oxygen has been reduced from 3 days to just 3 hours. That's a great thing. Our model, we have proved this model in Rwanda and Kenya, and now we just started in Ethiopia, and we are looking forward to the great impact there. Increased oxygen means that newborns are being saved, trauma patients are getting treatment, and surgeries are being performed at the healthy center facilities where we operate.
There's still so much that needs to be done to fill the huge gaps that are there in surgical care. We need to come together as a global community. We need to advocate for access to safe surgery as a part of universal health coverage. There's no global funding for safe surgery, and that needs to change. We know that if we all work together and come together to view safe surgery as an integral part of a strong healthcare system, we can work together so that everyone, everywhere, has access to safe surgical care. so that every mother around this world has access to that same safe C-section that I had years ago, ensuring that her life and her baby's life can be saved. Thank you.
Thank you.